So we have right here cardiovascular physiology. So what's the job of the heart? Basically to pump the blood, right? And when the heart pumps the blood, then it's going to create some sounds. And that got to do with the cardiac cycle, right? Cardiac cycle right there, right? In the cardiac cycle, what are you going to have? Well, ventricular filling, isovolumetric contraction, ventricular ejection, and isovolumetric relaxation, right? Those are the 4 steps. Now, when we do that, there's going to be a moment in time in which the valves in our heart are going to be closed and they're going to be open. So when the atrioventricular valves close, right, they produce a sound. And that one is going to be the first sound. Then the other one is right here, second heart sound. That one is going to happen when the semilunar valve in your aorta and the semilunar valve in your pulmonary trunk close. Let me see. Oh, right here, you see? Closure. So then we have these main 2 sounds, S1 and S2. Most of the time, how doctors and assistants and nurses listen to the heart, listen to these sounds that we're talking about. Well, we do that with a process called what? Auscultation, right? And for that, you need your stethoscope auscultation right there. So then in general, right, there are different areas in your heart that are going to be used in order to listen to the heart, right, to these sounds. Since we have 2 atrioventricular valves and 2 semilunar valves, then there are 4 identified places where we can actually listen to these sounds. And those are the ones that you see right here. So one of them is going to be the aortic area, pulmonic area, right, tricuspid and mitral area. So basically it's the second intercostal space, this one right here. So it's intercostal space, right, not on top of the rib, right? Because obviously that's going to cover the sound, right? It's going to block the sound, so it's better to do in the space. So you do that in the right side, that's going to be aortic. You go to the second intercostal space, but on the other side, that's going to be the pulmonic, on the other side of the sternum, as you have said. Then you go down 2 spaces to the 4th space, more or less, which is sort of this one, the tricuspid. And then this is your clavicle right there. You're going to get the mid-clavicular line, basically the middle of your clavicle, and you will go down like that. And then you will go like this, and more or less around here. That's when you're going to hear the other sound. So basically what you do is second, 4th, and then go to the left, towards where the middle of your clavicle. So, and what are those areas we have right here? Aortic, pulmonic, tricuspid, and mitral, as you can see right there. Okay, so then when we do the auscultation, we try to listen to this sound right here. But in addition to that, we also try to identify other things, such as, for example, the heart rate, the heart rhythm, et cetera, et cetera. There are other sounds. They are actually putting that in here. There's S3 and S4 in the stethoscope. So it's going to have here, bell, diaphragm is on the other side right there. It's going to have like a membrane. And obviously, you're going to have the earpiece. That's the stethoscope, and that's what we're going to use in order to listen to the heart. Right, so then if we keep scrolling down right here, now we go from there to blood pressure. Blood pressure is going to be determined by two main factors. One of them is going to be the cardiac output, and the other one is the peripheral resistance. Right, the cardiac output is determined by the stroke volume and the heart rate. And the peripheral resistance has other factors that are going to affect that, such as, for example, what vasoconstriction and vasodilation. In addition to that, another factor is going to be the blood volume, right? Because the volume is going to give you the actual pressure. Okay, so then let's keep going. So then how are you going to determine that? Then we're going to use a device in order to measure the blood pressure, which is going to be called the sphygmomanometer. The sphygmomanometer will register 2 different types of pressure. The pressure when the heart contracts, which is going to be called cardiac systole. So therefore, it's going to identify the systolic pressure. That's when the heart contracts, produces more pressure. Therefore, you're going to get systolic pressure. When the heart relaxes, then your heart is not going to produce that much pressure, and that's going to be called diastolic pressure, as you can see right there. In more circumstances, in most of the cases, right, the systolic pressure is more or less between 100 and 120, more or less, right? And the diastolic pressure is going to be between 60 and 80, more or less, right? I mean, and this is obviously a picture of how you're going to take the blood pressure. They're going to use the sphygmomanometer, which is this one right here, right? They're going to use the stethoscope, and you're going to have a valve in here that will inflate this cuff. So basically what you're trying to do by increasing the air right here in this cuff, you're trying to block the blood flow in the brachial artery. And then you let go of the air. And then obviously if you let go of the air little by little, then the blood will start flowing because the pressure in the cuff will be reduced. So the first time the blood starts flowing, it will produce a sound. How will you know what that sound is? Because you will be able to listen to that sound using the stethoscope. Now let's keep going now to the lymphatic system. So the lymphatic system, it has three main jobs: transport excess fluid. Number two is going to absorb fat. Okay, number three should be around here. There you go, number three. It's going to activate your immunity. So imagine that this is the heart, right? So the heart is going to pump the blood like this. And we said the heart pumps the blood 1, 2, and then goes to the lungs. And then from the lungs goes back to your heart. And from your heart goes outside and it returns back to your heart. So then the blood vessels go start in the heart and return back to the heart, right? If you look at this figure right here, guys, the lymphatic vessels don't start in the heart. The lymphatic vessels start on the tissues, as you can see right here. You see, they go this way like that. And they're going to collect fluid from the tissues. When they collect this fluid from the tissues, they're going to return it, not to the heart. As I said, they don't going to end in the heart, but they go right here like that. And they're going to end, and they're going to dump all the fluid right here in the subclavian vein. And right here in the subclavian vein. And from the subclavian vein, actually, they're going to end up in the vena cava, and from there in the heart. You have a better view of that right here. Since this is the lymphatic system, a system is composed of organs. So we're going to have the thymus, which is this one right here. We're going to have the spleen. And we're going to have a whole bunch of lymph nodes like that. Now, we have two main lymphatic vessels, one for the right side and one for the left side. And the reason why is that is because the right lymphatic duct, this one right here, the one that ends right here, is going to absorb the fluid from your entire right side like that, all this right side like this. So basically we can say it will reabsorb the fluid from 1/4 of your body, because the left one will reabsorb the other 3/4, all this. Like that. Right here, we're going to have an enlargement, which is going to be called the cisterna chyli, which is at the level of the abdomen, basically. Right. So this one is like a reservoir that is going to get all this fluid from here, right? From there. From here, what's going to continue, this is going to be called the thoracic duct. Here, thoracic duct right there. And this one right here is going to be the right lymphatic duct. This one right here, right lymphatic duct. In the lymphatic vessels, you're going to have, as we said, a lymph node. So the lymph node is going to have a lymphatic vessel that goes inside, and it's going to have another one coming out of it, right? So then efferent is this one, afferent is this one, because the lymph node is going to be in the path of the lymphatic vessels. Here it says thymus is one organ. We're having here lymph nodes, those are another organ. Okay, so right here you have the lymph node, right? So there are different structures in the lymph node. As I told you, we're going to have afferent lymphatic vessels, and you're going to have efferent, right? You're going to have, for example, a cortex, right? This area right here is the cortex, and in the middle, you're going to have basically the medulla right there. Inside there, you're going to have germinal centers. So your trabecula is these spaces in between germinal centers. Now, in addition to that, we're going to have the spleen, right? We have only one spleen, right? And it's located on the left hypochondriac region in our abdomen, right? Where you're going to have in there an splenic vein and a splenic artery. The spleen is going to have two main jobs. One of them is going to relate it to the red blood cells, the other one to the white blood cells. So that's why in the spleen, when you cut it open and you look at it using the microscope, you're going to see that in there you're going to have red pulp that got to do with the red blood cells, and white pulp that it got to do with the white blood cells. In addition to that, the spleen also has a capsule. Okay, so we have mucosa-associated lymphatic tissue right there. This is the lymphatic system, right? And if it's a system, it's because it's going to be composed of organs, right? So then these organs are going to be, for example, the spleen. In addition to the spleen, we are going to have tissues. And some of these tissues, for example, are going to be called MALT. Okay, that's what you can see here. Mucosa-associated lymphatic tissue, right there. Since this is a tissue, as you know, tissue is a group of cells. When this group of cells, they are all together like that, forming like a mass. It's not an organ, but a mass of cells, right? That is an example of a tonsil. Then if we keep scrolling down right here, they are showing some of those right here, right? Okay, so then if we keep scrolling down, we have lymphatic organ histology, right? Histology is the study of the tissue, right? So in other words, this is what when you need to use your microscope. So we're going to have the spleen, where we say we're going to have the red pulp and the white pulp right there. Okay, we are going to see the lymph node when we say we're going to have a medulla and the germinal center, and we have a cortex and we have a capsule, right? Peyer's patches. Peyer's patches are mold. Remember, these are mucosa associated. In this case, the Peyer's patches, they are going to be in your intestines, okay? You're going to find Peyer's patches, therefore, in your intestines. So right here, you have a figure of your spleen. The spleen is going to have white pulp because that's the part that is going to be associated with the white blood cells. And the red pulp, that's the part that's going to be associated with the red blood cells. So if we keep scrolling down right here, here you have, for example, here a lymph node where you have here cortex, medulla, right? You have the germinal center. You can clearly see them right here. These kind of circles in there, right? It has a capsule, as I mentioned before. This one right here is the intestines. Okay, so if those are the intestines, then what are these groups of cells right here? Then these ones are going to be the Peyer's patches, as you can see right here. If we keep scrolling right here, so and this is an example of a tonsil right there.